palliative care here at NYOH is about helping you live as well as you can while you're being treated for cancer. Think about us as an extra layer of support. It comes in the addition to the chemotherapy or to the immunotherapy, radiation therapy, any kind of therapy that you are receiving to help you feel as good as you possibly can while you're going through what you're going through. We as a team, we wear different hats depending on what is the most helpful at the moment. If you think about what we do, think about 3 S's. One S being symptoms, the other being side effects, and the third one being stress. And when we think about symptoms, they can be either from the cancer, like pain, side effects from mostly the treatments that our oncologists are providing here, such as nausea, fatigue, which is a biggie for all the patients, constipation, diarrhea, all of the gastrointestinal symptoms, and the stress of having the cancer, being diagnosed with it, not knowing what's going to happen. We always work as a team. As you can see, there's 2 of us here, and then there are another teams providing the same type of care. There are another teams providing the same type of care at other locations. And we always work as a nurse practitioner and social work combo. And also on our team, we like to have patients' families because everybody comes at it with their own bag of tricks, with their own experiences. And we are trying very hard to include and make sure that it's prioritized because it doesn't fit all. The treatment doesn't fit all. The treatments that work for one people are not a good fit for others. So we try to keep that first and foremost. We try to provide opportunities and suggestions and recommendations when it comes to medications, but not only. We do a lot of non-medication recommendations. It all depends on what works for you, for the patient.
Yeah. So as Meg was saying, we're always side by side when we get to meet with patients and their families. And really it's about creating a new team, which you as the patient and your support system, your family becomes part of. And I think what we often hear from patients as being really unique about working with palliative care is how much time we get to spend with you. You're in and out of so many office visits, and there's always so many questions and things to go over. When people come in and sit down with us, they really get time to kind of breathe. And we get to know you, not just the physical parts of what's going on, but really you as a whole person. To make sure that you are getting the information that you need and that your voice is being heard, and that you are really helping steer your medical care. And that includes your family weighing in on that as well. As Meg mentioned, we do a lot of medications. We also have a lot of other tools in our tool bag. Patients have said we're kind of like a Swiss Army knife. But we base those recommendations on getting to know you because we have the time and opportunity, and we're grateful that NYOH provides us with that so that we can really cater your care to you and to your needs. People often ask us, when is palliative care appropriate? And right from the beginning. So as soon as somebody gets a diagnosis of cancer, we can become involved. That initial period of hearing the word cancer, finding out what treatment you're going to be looking at, that is a very overwhelming time. And patients often come in and they say, I just feel lost. I'm seeing so many different people. I'm meeting different people. I feel like I'm, part of this big system and I don't even know what's up and what's down anymore. And when they come in and sit with us, it's kind of that pause button to, again, make sure that they're heard, they're seen, and that their voice is at the table. And anytime after that, we can become involved as well. So our little saying is kind of any age, any stage.
But the sooner the better.
Yeah, yeah. The sooner we get to know you, the more we can help. And patients do often come to us and say, like, wait, why didn't I connect with you guys before
where were
this?
You guys?
I wish I had known. So it's always nice when we get to meet people from the start. And again, it's really about helping you live a good life while you're going through this treatment, whether that's more with symptoms or side effects, or whether it's about, this stuff and the stress. We really try to meet you where you're at and go from there.
There's no set way how we do our visits. Sometimes it's all symptom related, but this is the place in the visit that is just for the patient, and the patient is the one that dictates what's the most important today. And today the most important thing might be I cannot go for a 5-mile walk anymore, and this is devastating. So we talk about that, and the next day might be something else. We hop on the phone a lot with people in between the visits, trying to tailor the help that we can provide. So it's very personalized. So one of the many ways that patients can access palliative care here at the NYOH is they can either request it straight from the oncologists, talk to the nurses, mention it to anyone. They know who we are, they know where we are, they know how to connect patients to us. For patients that might think about, is palliative care right for me, and they are not cancer patient or connected with NYOH, there is a website, getpalliativecare.org, where anybody can go on and see what resources they have locally, or they can reach out to their primary care or a specialist and ask them, is palliative care right for me?
I think one of my favorite kind of pieces of feedback that we've received from a patient is that the palliative care team helped them make the storm more bearable. So that's what we're here for.